Okay, good evening, professor and classmate. This is Daniel from Vegas. I'm going to start my video discussion question one by one. The first one is like, how do other people perceive me? So I do a really quick interview with my wife and my assistant at the clinic. Both of them think that I'm a person that have the really responsible, patient, and hard work. The thing we are, I when I'm working, I'm really actually really rational, manageable, and will finish my work really good. I'm willing to help each other, especially when I'm working. My assistant think I'm a physical therapist who is reliable and taking good care of the patient, but also at the same time learning, like willing to learn new technique. So the second will be identify one element of how other perceive you that you are interested in changing. So based on my colleagues, I think most of them, not only the one I asked, like this is kind of like the overall feedback from my colleagues, no matter from this clinic or my previous working clinic. Some of them in the beginning they feels like I'm not approachable. Like I will be so serious when I'm working. Um, I don't like to talk a lot, no matter to the patient or to my assistant. I mean, I think it's still important to explain or like doing the education to the patient, but I don't really like to have a chill talking with them when I'm working. So some of them will feels like I'm not approachable, or like I'm a little bit too serious, like they're not able to um, kind of like have a really close relationship with me. The third question will be, what are the reasons why they form this perception? I think it's like especially when I'm working, usually quiet. I don't like to talk a lot because I think it's also about my technique when I'm providing physical therapy. It requires a lot of texture feedback, and I have to be really focused on what I'm doing, concentrate on the feeling from my hand, the really fine minor movement or like a texture from the patient. So I'm usually quiet, concentrate on what I'm doing, especially I'm working. Put it on my documentation and my patient, my intervention. So I don't really have that the mind, or I don't really have that time to like play a joke or like trick talking with my colleagues or patients. So sometimes I'm a little bit over serious. So what have you done to contribute to the development of this perception? Uh, so well, I mean, based on my INTP, I'm an I person, introvert, and so I don't really like to speak with other people especially during working or to I mean, as a physical therapist, I'm basically a leader of my team. Um, I mean, I think it's like the set of the clinic. Like I do, even though I'm actually the leader, but I don't really have to um, tell my team member what to do, because most of the time they will read my documentation to understand, or to know what I would like to set up the couple of patients. So I don't really like to speak to them what I'm thinking, my opinion. Usually I put the work first. I finish it first. But recently I'm trying to. I think it's also because of the FIFA is actually happening now. Like I will try to, um, after I finish my work for sure, I will try to engage to their like group talking or like group chatting about the FIFA, about their life, like after work, their hobby. I do find it's actually really good because I develop, or like I've revealed actually a lot of like common hobby between me and my colleagues. So yeah, I think it's actually a really good way to break that kind of stereotype or like that kind of perception. The last question will be, do I think there are perceptual errors that contribute to this perception? Are they stereotyping or are they engaging in a selective perception? So I think it does. Most of it is basically by the selective perception, because like during working I'll have like kind of like a working mode. Um, will be help me to concentrate on my, because like what I mentioned earlier, like technique I use or like I good at this, actually it require a really focused time and really strong intense concentration on the patient for those really minor changes of the body. So I'm really focused on what I'm working on. Um, Based on that, so I will be quiet. I don't talk a lot, because once I start talking, I will lose my concentration and my focus on the body. So, uh, yeah, also like I'm an introvert person, so I don't actually actively talk or like chat a lot with other people before we actually you have a really close relationship. But I'm really willing to helping, especially when I'm working. I feels like on the team. It's actually really important that the team members help each other. So yeah, based on that, I don't think that's kind of stereotyping, because it's based on what they see, or like whether just a part they see, that's selective perception. Like they just know the working mode. They don't really know off working mode from me. So yeah. So for this one question, I would say it's selective perception. Okay, this is my answer for this discussion question. Thank you for listening.